Back now on Triad Today, and let's spend a few minutes talking about different types of therapies: occupational therapy, physical therapy, speech therapy, and we have an expert in this field. First-time visitor to the show, Nina Whitley is occupational therapist, and she's manager of inpatient rehab for Northern Rehabilitation, part of the Northern Regional Hospital family, and we welcome you to the show.
Thank you for having me.
First, tell us about, now, where is Northern Rehabilitation? I guess it's near the hospital, but where are you located?
Yes, well, we are inside the hospital, and we also have an outpatient clinic less than 2 blocks away from the hospital.
Now, you have kind of a dual title that I just introduced you by, so what kind of services do you manage? What's your role?
So basically, I started in Northern Regional Hospital in 2005 as a clinician, and then I was promoted to management in 2012.
Now, I know this is going to sound like a stupid question, but I want to throw 3 terms out at you and let you help us determine what the difference is in these. We'll do physical therapy, occupational, and speech. So let's start with physical therapy. Very quickly, what is physical therapy?
Physical therapy is basically a therapy that basically the goal is to get patients up and moving. They focus on the gross movement, lots of injuries, trauma, surgeries.
Coming out after surgery or
absolutely,
something?
Absolutely.
You could have a hip surgery, or you could have had an
joint
accident.
replacement, yeah, brain injury, spinal cord, anything and everything. Basically, goal is to get them back to function. They focus on moving the body and going.
Then occupational therapy.
Occupational therapy, we focus on little steps. So basically, we work on the skills that is going to lead you to this big picture. So basically, our goal is to work on strengthening skills and modification techniques to get the patient into performing the activities of daily living.
Right.
So let's just say as a mother or as whatever your job is, you have to learn many steps to get to the big picture.
Yeah, so I mean, you could, like I said, you could be coming off of a surgery. You need physical therapy anyway, but then you say to the therapist, hey, you know, my job is, I'm an auto mechanic. Well, then all of a sudden you've got to be thinking, okay, now how can I?
What the little things will take you to get there, yeah. It's not only the body, you know, the movement, but all the skills that you have to learn to get to that end result.
And then speech therapy.
Speech therapy is basically swallowing after strokes, developmental delays. A lot of times when speech impairments are a factor, they will work with after trauma. They work on basically rebuilding their vocal cords and swallowing abilities and all that stuff.
And that can be a tough thing. I know we just referenced people that might have just had surgery or something. They need physical therapy or occupational therapy. Some of that will start in the hospital, and then you'll move and do some at home or go to a center. But with speech therapy, it can be kind of a long process, right?
It is. For all can be long, but definitely that's more complicated and it can take longer. And we'll do that inside the hospital. Of course, if they're admitted to hospital, we'll go work with them in the room daily. If after that, then we can do outpatient.
Right.
Sometimes we can do home health and different settings that we can cover.
Who or what led you to a career in healthcare?
As a child, I've always was fascinated by hospitals. When I would watch movies and TV shows, I thought it was just cool. I've always thought it was amazing what it actually takes to take care of a patient inside the hospital. And as I got older, I got interested in rehab field. And when I went to college, sat with an advisor, and she started telling me about OT, and basically just got my attention. And here I am, 23 years later.
Wow, you don't even look like you're 23.
I'll take it.
All right, no, I appreciate that. Up on the screen, a couple things. You can call 719-7129, I believe is the number for an appointment. Physicaltherapymontairy.com is the website we have up on screen that's specifically for Nina's office. And also the general website for Northern is choosenorthern.org, and we hope you will check out those websites. Nina, thanks for all the help you give to people.
Thank you. Thanks.
All right. We'll be right back after this.